While U.S. meat processors have spent hundreds of millions of dollars on measures to protect their workers from getting sick, the industry has still experienced a surge in cases. And now companies say they are limited in just how much they can do to keep workers separate from one another. The Washington Post reports that the nation's meat supply remains deeply strained and says a report from CoBank, quote, warns that meat supplies in grocery stores could shrink as much as 35%. Prices could spike 20%, and the impact could become even more acute later this year as the knock-on effects on the U.S. agriculture supply chain are felt. The paper continues. The prospect of long-term shortages is giving rise to an intensifying debate about whether the industry should reopen faster or whether safety should be prioritized, even at the cost of the nation's food supply. According to the Post analysis, over the past month, the number of infections tied to 3 of the country's biggest meat processors has gone from just over 3,000 to more than 11,000. Meanwhile, the number of grocery store worker deaths and infections has doubled in the past 5 weeks. There's been criticism of grocery chains for failing to properly report these numbers and for ending hazard pay for millions of workers. America's largest food and retail union is now calling on what many have dubbed hero pay to be reinstated, which for many grocery store employees is an extra $2 an hour. Joining us now, President of the United Food and Commercial Workers International Union, Mark Perrone. Thank you very much for joining us, sir.
Mark, thank you so much. I've got a son who has diabetes who was working at Publix and early on in the pandemic, because he's a diabetic, they actually suggested to him it might be safer if he went home, and they actually paid him for a couple of weeks because of his condition. And my experience with them, our family's experience with Publix has been fairly extraordinary. I've got other family members who work for Publix. But that's not the case across America, and it's certainly not the case in a lot of these plants. What do grocery stores need to do? What do these meat processing plants need to do to protect workers first?
Well, first of all, they need to have PPE, personal protection equipment, that will protect them both from transmitting the disease as well as getting the disease themselves. Now, if the customers or if people next to you don't wear a mask, you're going to have an N95 mask or better in order to make sure that you don't get the disease. Now, in some cases, that's very difficult. We discussed that as it relates to the packing houses, whether or not you can actually provide protective equipment that is good enough at that level under those conditions to provide personal protection. I think you can. It, however, has to be at a different rate, and it's going to be more expensive. So,
Mark, it's Willie Geist. Good to have you on this morning. Can you speak to the meat packing plants and what it is about those facilities that have caused them to be such incubators and hotbeds for coronavirus? A lot of them are beginning to reopen, as you know, but along with long-term care facilities like nursing homes and prisons as well, these meat packing plants have really had a problem. Are you convinced that they are safe, that they've resolved in some degree this problem and that people can go back to work?
Well, Willie, I think that you really kind of talk about the science of it, right? So the science of those packing houses is that there is high volume air pressure in those units in order to refrigerate those processing areas of the plant. So, and there's also a lot of humidity. So the humidity keeps the virus and the particles in the air from actually evaporating very quickly. That's one thing. The other thing is the amount of air volume that flows around in those units is at very high pressure, and that pushes the virus around. So could you potentially, increase the amount of filtration on the air handler units inside those facilities? Yes, you can. I don't think they've gone that far yet, but they should. In addition to that, there should be masks that have the more infectious control disease type mask that might have the filters that are in behind the worker, and they have a tube that runs from the mask behind the worker in order to protect them. But it's a much higher level of protection than just NP95 masks.
Excuse me for interrupting, Mark. And as you know, some of those closures have led to concerns about the availability of meat in this country. There have been further concerns. You mentioned grocery stores, about some of those shelves eventually being empty or there being sort of a scramble to get food in this country. Do you think those concerns are overstated, or do you believe that's going to become a real problem?
I think there's going to be limits of certain types or certain cuts of meat at different times. I don't necessarily think that we have a food shortage, but there could be some limitations depending on what that particular plant might produce, if in fact they have to close for 14 days to allow for a quarantine period to take place and to ensure that those workers are healthy and safe. And there is no reason why we shouldn't be able to do that in this country.
President of the United Food and Commercial Workers International Union, Mark Perrone, thank you.